Hi, welcome to a short lecture series on VT, VF and Asystole. If you did not subscribe to my channel, please like and subscribe to my channel. VT or ventricular tachycardia. Only QRS complexes are repeatedly occurring in this kind of waves. Okay, so ventricular tachycardia produces low cardiac output and changes to ventricular fibrillation very easily. Okay, the main cause for ventricular tachycardia are mainly the myocardial infarction or R on T phenomena or the PVC landing on T wave. That is another reason. Then cardiac drug toxicity and electrolyte imbalances usually causes ventricular tachycardia. Then we have ventricular fibrillation. So ventricular fibrillation, again a fibrillatory waves can be seen. Okay, and the QRS, but atrial fibrillation we can see the QRS complexes are distinct, but here the QRS complexes appears like fibrillatory waves. Even P waves cannot be identified properly, so it is called as ventricular fibrillation. Atrial fibrillation we cannot identify only the P wave, but QRS complexes will be distinct, and this kind of ventricular fibrillation may not produce any kind of heart rate. Okay, ventricular fibrillation originates in the ventricles, resulting in no cardiac output, and codes ventricular fibrillation amplitude 3 mm or more. Okay, so the height of the waves will be 3 mm or more. Okay, fine ventricular fibrillation amplitude less than 3 mm. Okay, this is coarse ventricular fibrillation. Okay, but there may be some fine ventricular fibrillation. Okay, this is an example of coarse ventricular fibrillation, whereas we have fine ventricular fibrillation. The fibrillatory waves may not go above 3 small boxes. Okay, so that kind of rhythm, this kind of rhythm is called as fine ventricular fibrillation. And at last we have an asystole. Asystole, there will not be heart rate and no cardiac output, and the waves will just fluctuate or just move in a straight line, either an isoelectric line or just show minute fluctuation. Okay, so it is an end stage rhythm and rarely occurs due to excessive vagal tone and response to vagolytics such as atropine and transcutaneous pacing. And check pulse and lead connections before confirming asystole. Sometimes when you check the pulse will be present, but the ECG shows an asystole. Then there is higher chances that the ECG are misconnected or some of the leads are not properly connected to the chest. So before declaring someone as a dead, we have to check the pulse in order to confirm the proper functionality of the ECG machine. Okay, and all the leads are properly connected. Okay, thanks for watching my video. Please like and subscribe to my channel.